Good afternoon, and welcome to the City Club of Cleveland. My name is Jan Roller, and I am president of the club. Our speaker today, Tom Zenty III, is the CEO of University Hospitals. That's his title. But in reality, he is also a key leader in the transformation of Cleveland and Northeast Ohio recovery. His work is at the very epicenter of the revolution that is remaking this community. Let me give you two prominent examples from just yesterday. Governor Ted Strickland announced that the recently formed Health Tech Corridor, stretching from University Circle to Cleveland State University, is now a state-designated hub of innovation and opportunity, giving it priority for state funding to fuel growth in healthcare and biomedical device companies. Also, medical imaging maker Philips Healthcare announced that it will open a $38.4 million global research and development center at University Hospitals Case Medical Center. These are just two current examples of the impact of University Hospitals, UH, and its partners have on Cleveland and Northeast Ohio. But of course, the system that Mr. Zenty runs is first and foremost a provider of the highest quality health care. UH serves patients at more than 150 locations throughout Northern Ohio, including 7 wholly owned and 4 affiliated hospitals. Located in Cleveland's University Circle, UH flagship medical center, University Hospitals Case Medical Center, is the primary teaching affiliate of Case Western Reserve University School of Medicine. Together, the Medical Center and School of Medicine form the largest biomedical research center in Ohio. Also included in UH are Rainbow Babies and Children's Hospital, one of the nation's best children's hospitals, Ireland Cancer Center, Northern Ohio's only National Care Institute, designated a comprehensive cancer center, the nation's highest designation, and McDonald's Women's Hospital, Ohio's only hospital for women. Mr. Zenty has a massive job managing this system, which includes more than 24,000 physicians and employees. UH performs more than 4.5 million outpatient procedures and has nearly 63,000 inpatient discharges annually. UH has been serving patients for over 140 years, but as yesterday's announcements show, it has an eye on the future. It outlined a vision in its strategic plan known as Vision 2010, the UH difference. It calls for investments of more than $1 billion over 5 years. The plan reaffirms strong commitments to the University Hospitals Case Medical Center campus, with new facilities and expansion of services, along with new construction and enhancements to its suburban ambulatory centers. Mr. Zenty's path to this role started in a small rural town in eastern Pennsylvania. The town's family physician saw his academic potential and encouraged him to think about a career in medicine. But Tom knew early on that although he liked the scientific component of medicine, he knew that he didn't want the life of a doctor. And after completing his education, he set out on a career of healthcare leadership at health systems in Arizona, New Jersey, and Connecticut. And he came to University Hospitals in 2003 after serving as Chief Operating Officer at Cedars-Sinai Health System in Los Angeles. For all of his successes in guiding UH through challenging times, perhaps nothing says more about Mr. Zenty's commitment to the health system he has led for the last 7 years than his personal gift commitment of $1 million to support UH's Vision 2010 strategic plan. He made the gift in honor of his parents, Edna and Thomas Zenty Jr., noting that his parents instilled in him a strong work ethic and a sense of social responsibility that guides him today. Ladies and gentlemen, please welcome Mr. Thomas Zenty.
Well, Jan, thank you for that kind introduction and way too lengthy, but very much appreciated. I have some time limitations in terms of what I'm going to be talking about today because we are going to be broadcasting today. So let me start by saying that I'm honored to be invited to the City Club representing the boards, the physicians, the researchers, employees, and volunteers of university hospitals, where we have been pursuing our mission to heal, to teach, and to discover since 1866. Many of those people I just mentioned actually are here with us today. I hope to provide perspective on a very important issue that will affect each of us and our families at some point in our lives. It is an issue that has been the subject of rigorous and rancorous debate and has been a major topic of conversation and a Gordian knot for business leaders, government officials, the healthcare industry, and virtually everyone in the United States for quite some time, and that is healthcare reform. More specifically, my focus today will be on the sweeping healthcare reform legislation that was passed just a few months ago, entitled the Patient Protection and Affordable Care Act. Today, I will give you a brief overview of some of the most pertinent components of the reform bill, discuss the challenges created by what is included and by what is omitted, and talk about what we can do to gain the benefits intended by this new legislation. And I will try to condense over 2,400 pages of the Act and its impact in the next 23 and a half minutes. Keep in mind that the bill itself says more than 1,000 times that the Secretary will issue regulations and guidelines. So its final form is not yet clear, and the outcome of this year's midterm elections may create additional legislative modifications. My presentation today is the result of a lot of what I'll call synthesis research. There is so little certainty in this health care bill that I wanted to make certain I was going to be giving you appropriate information from a number of different sources. And I'm pleased to say that there is a lot published, but there is still a lot yet to be done. One fundamental tenet, however, is that the healthcare system of tomorrow will not be the same as it exists today. Much of the discordant, uncoordinated, episodic care for the uninsured will largely be replaced by mandated insurance coverage. A stronger focus will be placed on paying hospitals and physicians for outcomes and the quality of care that they provide. Insurers will be more highly regulated while offering coverage options through new venues, such as health insurance exchanges. Medicaid recipients are anticipated to increase by 40%. Pharmaceutical companies will see pricing pressures. Device manufacturers will now pay new taxes on their products. Mature biologic manufacturers will see a decline in revenues, while generic manufacturers will see an increase in sales. And businesses will face the choice of providing and paying for health coverage or paying fees if they choose to opt out of the provision of coverage for their employees. So let's take a moment and examine the history of reform. Bringing change to healthcare in America has been a long and a very arduous process. During the past year, we have seen and heard so much about healthcare reform in so many venues that it is hard to remember that reform has been an idea advanced by leaders of virtually all political persuasions, and our nation has contemplated overhauling or changing our healthcare system at least 6 times in the past 100 years. Healthcare was a key issue in Theodore Roosevelt's 1912 presidential campaign. In 1948, President Harry Truman convened an extraordinary session of Congress to attempt to create a national healthcare program. In the early 1970s, President Richard Nixon proposed a comprehensive health insurance program that would have required employers to offer full-time employees insurance coverage. And of course, almost 2 decades ago, President Bill Clinton sought to overhaul American healthcare. So the question is, what happens when a century-old idea finally becomes a reality? 3 simple words represent 3 complex themes important in healthcare delivery, and these 3 themes are cost, access, and quality. This new reform legislation has predominantly focused on addressing one of these themes, and that is access. Access to insurance coverage, changing the way patients access the healthcare system, and access to information allowing individuals to make more informed lifestyle and healthcare decisions. First, let's address access to health insurance coverage. In many ways, once implemented, health reform provides an opportunity to make the insurance market more balanced and inclusive, and carrying with it its own actuarial challenges. This bill builds on our current employer-based model and aims to make obtaining and keeping coverage easier and more affordable for employers and for individuals. Beginning this year, 32 million currently uninsured Americans will begin to have access to health care coverage that for so long has eluded them.